Some Cuban doctors currently in South Africa, through the bilateral medical agreement, fear becoming illegal aliens after opting out and having their passports cancelled. Their lawyers question the HPCSA and its role in the matter.
By simply cancelling the passport, they've essentially rendered them without work, and because they've been without work, they also need to leave the country. So it's a very sneaky manner of sort of getting them to have to come back to Cuba.
Unable to obtain South African citizenship and living in fear of deportation back to Cuba, they say they are left in a serious dilemma as they are seen as deserters.
If any doctor wants to opt out, they need to go back to Cuba. So we have the responsibility as the government of South Africa to say our relationship ends here, you go back to Cuba.
Last month, we brought you the story of Cuban doctors deployed in South Africa in response to COVID-19 and told how we were not allowed to access them. In this episode, we explore the experiences of some Cuban doctors under the medical program and their struggles resulting from their contracts. President Nelson Mandela's first visit abroad soon after his release from prison was Cuba. It was a mission to personally thank President Fidel Castro and the Cuban people for their contribution to the fall of the apartheid state. As president, one of the agreements he signed with the communist island was the intergovernmental bilateral cooperation in the health sector.
After the agreement was signed in 1995-96, we got the first group of doctors coming from Cuba to South Africa. And that now, they were taken directly to the rural areas. So therefore, you can imagine in a facility where there was no doctor, all of a sudden there is a doctor.
The agreement not only involved health professionals coming to South Africa, but also the training of South African doctors in Cuba. A number of underprivileged students from rural communities are taken to Cuba each year for medical training. In 1999, at the age of 27, Stephen Pierre became one of the program's recipients. We spoke to him in our previous program.
Medical training in Cuba, there is more emphasis on preventative medicine. Now you come to South Africa, which is more of interventionist kind of. It means the disease is already at the end, and then you are intervening. So you are diagnosing and treating. So that in itself, and also because of the preventative training in Cuba, you do not get a chance to see a lot of severe condition of illness, HIV, TB, trauma, car accidents, gunshots, and all that.
Cuba says since its first deployment in 1963, so far about 400,000 Cuban health professionals have worked in 164 countries, delivering preventative and curative care to millions of lives. One of the concerns about the Cuba-South Africa collaboration is its cost. According to a 2020 Human Resources for Health study, in its early years, Cuba carried most of the costs for international medical collaborations and not African countries. But this changed over the years. By 2015, over 140,000 Cuban professionals were working in 67 collaborating countries. Cuba covers all costs for 20 countries. In 17 countries, costs are shared, and the other 30 countries pay Cuba for their medical support. In 2005, Cuba created the Henry Reeve International Medical Brigade to respond to global natural disasters and serious epidemics. But a US-based research organization, Cuban Archive, started mainly by members of Cuban origin and critical of aspects of the Cuban Revolution, alleges that the program is key to funding Havana's state machinery and serving the political ends of the state and its elite.
This is probably the most important program that Cuba runs because it is the primary source of revenue for the country. The export services, primarily of health, but other social missions, including sports trainers and educators, which healthcare is 75% according to Cuba, brought in like over $7 billion. And the second source of revenue for Cuba is tourism that did not bring in, it was less than $3 billion. It's not just that it sustains the regime directly into the treasury, that money goes for Cuba to spend preserving the elite, for doing repression, the repressive apparatus, and all the other needs of the government. That is a totalitarian regime.
A special dispensation has been created in South Africa for Cuban doctors under this program. Unlike other foreign-trained doctors, Cuban health professionals don't have to write a medical competency examination.
Once vetted, you would then be registered with the HPCSA and be given the limited registration of registration in public service.
Experts say the ANC-led government's historic ties to Cuba puts it in an awkward position. Does it uphold South Africa's constitutional values that promote human rights, or side with Cuba in its alleged disregard for human rights of its citizens who choose to opt out of the program?
Together for the freedom in South Africa, and we are fighting closely. We know
What this goes down to is more or less sort of the human dignity aspects of the medical doctors themselves and the conditions in which they are required to work and operate under. A great deal of these so-called treaty conditions are what would be regarded by most South Africans as quite sort of oppressive and abusive. I mean, they can be quite controlling.
One controversial aspect of this agreement is the doctors' salaries. Cuban doctors have to each transfer about 43,000 rand of their earnings in South Africa to the medical brigade account each month.
No. The Cuban government doesn't take the money. They enter into an exchange, a cooperation, a bilateral agreement. Okay? Cuba is short of cash. And the main reason is not the failure of our economy, it's the suffocating grip of, especially of the Trump administration, into the Cuban economy. It's not even political anymore.
Since the deployment of the first Cuban doctors to South Africa in the 90s, a number of them have terminated the agreement. The Health Department says they have an obligation as government to send them back to Cuba.
According to the agreement, if the doctor opt out, so it's not part of the agreement anymore. So therefore, South African government has got the obligation to transport them back home because they are not part of the agreement anymore. So their registrations fall off. We communicate with the professional council that this person is no more registered, so therefore cannot even practice in South Africa without your health professional council's registration.
We contacted the Department of Home Affairs to find out what the status of these Cuban doctors is. Despite promising to respond, they had not done so at the time of editing this program. In 2003, the then Home Affairs Minister Chief Mangosuthu Buthelezi took issue with the Health Department's attempts to create special requirements from 7 Cuban doctors who had opted out of the agreement and had married locals. Unlike other foreign nationals, they were required to produce consent letters from the embassy in their application for immigration permits.
It's a very sneaky manner of sort of getting them to have to come back to Cuba, which most of them don't want to because they've established families, this has now become their home. They're regarded essentially almost as traitors.
Lawyers for the doctors who have either opted out or are considering it, mainly due to the labor rights related concerns, say after their passports are revoked, working contracts are terminated, leading to deregistration by the HPCSA, leaving them unable to work as doctors.
We have cases where some of these doctors, when they opt out, their passport is cancelled by the Cuban embassy. So essentially, they can be deported.
That's got nothing to do with the HPCSA. We're not an immigration office. We're a registering authority to assess whether you have the competencies to do what you have to do. We register you, we don't offer you employment.
Lawyers argue that the doctors do not want special treatment, but to continue practicing in the public health sector, as their deregistration suggests that they are no longer competent when they disagree with the ill treatment. Since our last program on the Cuban doctors' deployment to South Africa under the government-to-government agreement, we approached some doctors that had opted out of this agreement to find out how they have been treated, but they said they were too afraid to speak out for fear of victimization. In Mpumalanga, we asked human rights lawyer George Khan to set up a meeting with some of the affected doctors to tell their stories. Although some had agreed, they withdrew, saying they feared retribution.
They are terrified to speak to anyone, including the media, about these issues out of fear that somehow it might be linked and brought back to them and tied back to them, that might have some sort of repercussions for them, negative repercussions that might jeopardize not only their careers, but their families in South Africa, or even their families back in Cuba, that they're very worried about, that they haven't seen frequently for many years.
Although a number of labor court judgments have found in favor of the Cuban doctors, Khan says issues of human rights abuses against Cuban doctors have not yet been properly addressed in our courts.
If you read the judgments, you'll actually see that the judges are quite sympathetic to the Cuban doctors because of these issues, but in certain cases, to some extent, their hands tend to be tied because they are unfortunately restricted to some extent by the Labour Relations Act and stuff like that. But if you're talking in terms of sort of High Court, Supreme Court of Appeal, Constitutional Court aspects, the broader issues are ones that include human dignity, equality, just administration, those types of issues. So, I mean, the bottom line is essentially that a lot of these Cuban doctors have a set of requirements imposed upon them, which a lot of people would regard as oppressive.
The Cuban Archives Executive Director alleges that Cuba will not admit to human rights abuses because they insist on a particular worldview.
There is a lot of propaganda involved, and Cuba has a very, very large apparatus for influence and propaganda. It's intelligence services. Most of their diplomats are intelligence agents. They're officials. They're trained for this. The propaganda, I mean, the whole country is essentially at the service of where the government says that they have to put their resources. And the main cause is to sell this idea that Cuba is a medical power.
The Cuban embassy dismisses this as a US-funded campaign by using non-governmental organizations to label its citizens as agents of communist indoctrination and propaganda. Politics aside, affected Cuban doctors are caught between a rock and a hard place.
The passport is critically important in a number of careers, also in mining. But essentially what happens is when the Cuban government cancels the passport, the person is no longer sort of within the agreement, and because they're no longer within the agreement, their registration falls through, and the moment their registration falls through, they no longer have a position.
Khan says, among others, the HPCSA has to explain whether they are colluding in discrimination against Cuban doctors compared to other doctors. In its written defense and the defense of the doctors' medical program in South Africa, the Cuban embassy denies all allegations, saying the entire matter should be viewed in the context of the United States strengthening its economic, commercial and financial blockade against Cuba. It accuses the Trump administration of increased coercive measures to suffocate Cuba, and the US of instructing its embassies around the world to spread misinformation about the alleged Cuban forced labor practices, as well as pressurizing other countries to cancel their medical cooperation agreements with Cuba. The embassy says Cuban health professionals overseas are employed doctors who volunteer and freely sign agreements to help in other countries. Their salaries continue to be paid in full in Cuba, and their jobs are secured back home. It adds individual doctors know their income in advance of signing contracts, and that a portion of it will go towards sustaining Cuba's free healthcare system. They say since 1997, only 1% of 7,000 doctors deployed in South Africa have opted out. Those who continue to live and work in the country are still Cuban citizens, but no longer qualify for special official passports. They are issued with ordinary Cuban passports afforded to all citizens. The embassy insists that despite the American smear campaign, it continues to receive worldwide acclaim for its medical program, including the WHO. We also approached the US Embassy for a response, but they said they were unable to provide comments.
In a human rights report released in late July this year, under the heading Cuba, Repressive Rules for Doctors Working Abroad, it says that receiving governments should press for change. It says that since March this year, Cuba has sent roughly 1,500 medical professionals across the world to fight the COVID-19 pandemic. Cuban government's regulations provides that workers may be disciplined for being friends with people who hold hostile or contrary views to the Cuban Revolution. Health workers may also face criminal penalties if they abandon their jobs.
Cuba says their deployed health professionals do not get involved in internal affairs or political activities of host countries. The health department says over the years the numbers of deployed Cuban doctors have decreased substantially.
As we speak now, we have around 212 doctors, Cuban doctors, that are deployed in the provinces in South Africa.
This is not including the Cuban Medical Brigade.
The 212 that I'm talking about? No. The medical brigade that came in, you mean the ones that arrived in April? Those ones came specifically for COVID. And those ones, after 1 year, they will go back home.
58-year-old Dr. Victor Figueroa arrived in South Africa at the dawn of democracy. In a previous program, we spoke to him. At the time, our repeated requests to interview the COVID-19 medical brigade were met with silence. Media access to the recruits was restricted. We were also refused permission to film their induction process at Sedibeng in the Vaal.
Why is so much always interest in derailing the beauty of the program to land in the materialist-orientated issue of how doctors are remunerated? I wish I would not be paid, but I cannot afford it because the aggressive capitalist society would prevent me from surviving.
Lawyers who have defended the rights of Cuban doctors to remain employed at government health facilities say they frequently get inquiries from other Cuban doctors contemplating to leave the agreement, but are still too scared to do so.
I would probably wager that the figure of 100 or no more is probably accurate. I mean, I would suspect that you probably find that there are two types of Cuban doctors that are affected by this. Those that have already relinquished themselves from this arrangement between the governments, and those that are contemplating it, but are terrified to do anything and are maybe very worried that their government is going to think that maybe they are going to do it and suddenly call them home again.
In terms of the agreement, while in South Africa, the doctors continue to earn their salary, which they say is higher than the average salary in their country. But Cuban Archives says doctors in Cuba are paid $70 per month, which is little more than 1,000 rand at the current exchange rate.
There's thousands of Cuban health professionals who have defected, including in South Africa, that could attest to this. And Cuba does not deny it. People need to realize why these professionals are so eager to sign up for these programs, because the average doctor in Cuba is paid $70 a month.
The sense of fear in speaking out among the affected professionals is a source of concern, particularly in a constitutional democracy like South Africa.
According to Human Rights Watch, many said they joined the program because they feared retaliation by the Cuban authorities. Others said they joined in the hope of leaving the country or of obtaining access to food, such as meat, which they cannot buy with their salaries in Cuba.
Cuba says despite limitations from the US blockade, it spends a substantial amount on its healthcare budget, buying medical supplies, equipment, as well as treating and educating its citizens for free. But opponents say supplies are limited.
They're very good general doctors who have to deal with almost no supplies, no modern equipment, that they have skills that are good and that they serve. So I'm not saying everything about the healthcare system in Cuba is bad.
The health department says it's aware of Cuban doctors that have used the courts to stay in South Africa.
There are other cases that we can talk of, people that have taken government to court demanding certain things from government. It's our laws, and the courts will still have to take decisions. And that is a court decision to say that must be absorbed. As I said, they come in, they're now selling their skills.
You can dismiss a person either because they are incapacitated, or you can dismiss them on disciplinary issues. And there's no disciplinary issue here. It's not that these doctors have conducted themselves in an unprofessional manner. The matter is simply that there's some political rhetoric that's going on behind the scenes that these doctors are frequently not even involved in. They have no knowledge of.
In cases that have gone before the court, the applicants argued that their contracts and passports were terminated without due notice. Others learned of their termination on the website with no reasons provided, interrupting their lives.
And because they are essentially not a citizen of any country, it makes it even more problematic. I mean, if you're at least a citizen of another country, you could go to the embassy of that country. It's a sort of ticking clock scenario. You might find a lot of the Cuban doctors have been here so long that their children that may have arrived when they were very small or even been born, or not necessarily born here, but when they arrived here when they were very small, aren't citizens necessarily themselves either on their path to citizenship, but because they are still within their permanent residency category bracket, they can't necessarily get in to study medicine themselves.
The lawyers say ultimately the matter will come to a head where the HPCSA will have to clarify the basis on which the doctors are deregistered. When the law is clear about under what conditions can any doctor be deregistered. In the meantime, these doctors who can only practice in the public health care system fear for their survival and that of their families, as their only income and their professions are in limbo.